Here I'm going to talk about terminologies that are used to describe errors during fetal or embryonic development. Let's say, for argument's sake, that we have a primordial tissue called A that gives rise to organ B. Now, Agenesis describes the situation where, due to the absence of the primordial tissue, the organ does not develop. So, absent organ due to no primordial tissue. Aplasia, on the other hand, describes a condition where there is absent organ despite primordial tissue is present. So A gives rise to B. A is present, but there is a problem in development as a result of which B does not develop. And hypoplasia describes a condition that again, primordial tissue gives rise to an organ, but the organ development is incomplete. So incomplete organ development. Now, deformation and malformation. Deformation is an extrinsic disruption versus malformation, which is an intrinsic disruption. And one important difference between these two is that deformation occurs during fetal period, which is after 8 weeks of gestation, versus malformation, which occurs during the embryonic period, which is between 3 to 8 weeks. So one example of deformation is the Potter syndrome, where due to oligohydramnios, fetus will be under pressure and extrinsic pressure from outside, as a result of which facial features will be deformed in these individuals. And malformation, any process that causes disruption during embryonic development at 3 to 8 weeks gestation is referred to as malformation. So just summarize what I explained there. Agenesis, there is an absent organ due to the absence of the primordial tissues, versus aplasia, organ is not present despite the primordial tissue is present. And then hypoplasia is incomplete organ development. Deformation is extrinsic disruption versus malformation, which is intrinsic disruption. And one main difference is the timing, where deformation is due to fetal period, which is after 8 weeks of gestation, versus malformation, which is during embryonic stage, and it's between weeks 3 and 8.